friends, and thank you for tuning in to another episode of the Optimal Health Program. Hope you're all doing well. Today we're going to talk about a variety of things, how cadmium exposure may link to damage to your memory and brain function. We'll talk about dementia arises with, as you might understand, increasing amounts of alcohol use. We'll talk about plant compounds in nuts and veggies may help to lower diabetic risk or risk of heart disease. A lot of cool information. Of course, we'll be taking your questions here for those of you who still have phones and want to call us. It's almost like I don't want to give the phone number out anymore. 888-420-9272. I've given out the phone number for 35 years when I was doing the radio show. And the phone number for the studio is just emblazoned in my brain forever. I guess I'm trying to push that out. But if people would like to call, they can do that, 888-420-9272. Otherwise, text us, reach out to us, email, or whatever other way. You can get the question to Frankie. We'll sit there and we'll take your questions and answer them as fully as humanly possible. And we love to chat with you. So let's first talk about heavy metals. These are things that are in our body and come from all over the place. The cadmium, lead, and mercury come from lipstick and makeup in most common sources, but in areas that are highly industrial, there's a great deal more of it, and that gets into the ground and the soil. It can get into food depending upon, what kind of soil the food is grown in. And my question would be, and just that idea, when people start to plant foods and such, do they test the soil before they create a farm, whether it's a local farm or a big agricultural facility? Because you don't want to have these things get into your foods. Cigarette smoke has a great deal of cadmium, and it's got a pretty significant impact on cognitive ability. In a couple of big studies involving over 20,000 people, cadmium, when you test that in blood and urine's more accurate, by the way, doubled the risk of cognitive impairment for people. And when I test for heavy metals, we do first in a blood test, because it's easy to take one tube and 3 seconds of blood to go into that tube to test for the metals. But the blood labs only check for 5 metals: lead, mercury, cadmium, arsenic, aluminum. Sometimes they'll do nickel. But the urine lab will test 21 metals and is more of a reflection of what you've stored as opposed to just the blood. That's a recent exposure floating around free before it gets stored. So the urine test is by far the more accurate. So you don't want to have any metals on board. All they do is cause damage. And, we've spoken about mercury. We've spoken about and correlations with damage to your heart with mercury. We've spoken about lead, aluminum. Aluminum is linked with dementia, and they think cadmium as well. And all the metals can be linked with dementia because they get into your brain and they start to damage the receptors that your minerals are supposed to get to because they have the same electronic charge, positive charge. So for all adults, we test for heavy metals. And you don't have to be working in a foundry, grinding metal in some sort of position or job. These things come from all over the place. Arsenic is in chicken, shrimp, rice, apples, California wine, aluminum in pots and pans, aluminum foil, antiperspirant. So we have to be, a little bit more conscious of our, close and personal environments.
Some questions from the Rumble audience. YouTube, you're slacking. But they just want to know, why are things like cadmium even in beauty products in the first place?
Most things that are put into products, whether we talk about beauty products or otherwise, are meant to stabilize the product, just like putting chemicals into food or spraying food so it looks nice on the shelves when you go to buy it in the market. All of these chemicals are put in to stabilize, and to some extent, many of the metals, like arsenic, are sprayed on crops to help to prevent the bugs from eating the crops. So, that's been done in wine in California. That's been done in chicken, where they feed arsenicals to the chickens so that the chicken don't get sick, but we get sick. So that's the lipstick and makeup, from what I found out, is that it seems to make it last longer. So there's a commercial on TV where some lipstick manufacturer says, oh, look, I don't know if it was Cindy Crawford, it was someone equally as beautiful who's wearing the lipstick, and she kisses somebody and the lipstick doesn't come off. So I guess that's a good thing. If you're going to buy lipstick, you don't want to have to reapply it every 5 minutes. but it's not good for you. So, and I tell people, go to Google Scholar, look up cadmium in lipstick, look up lead, mercury, all the individual metals, and look to see where they exist, and then kind of look at your home environment. And I told the patient this the other day, and they looked it up on their phone, that, wine from California seems to have more arsenic than anywhere else. And the local wines here don't, because it's tested. In Italy and France, there's this super process of screening, and the DOC and DOCG organizations really make sure that, the process of making the wine is perfectly controlled, so you're not getting that into the wine. But you could see probably 50 or so different label names of wine that are very common names. You'll see that in the store. They're everywhere, and they're not expensive wines, but you might be drinking your favorite wine from California that's got arsenic in it and adding it to your system. You don't want that. So if you think of a person who drinks a lot of wine or a lot of alcohol, it's not great for your brain. And it can wipe out hormones, can wipe out neurotransmitters, can wipe out minerals, and you're adding arsenic. It's like a double whammy. So if you're going to have wine, just choose the better wines, the Italian and the French. I also think that some Chilean wines have issues with arsenic too, but you could look that up on Google Scholar, one of my favorite search engines.
Should be your sponsor at this point.
Yeah, I tell people every day, go to Google Scholar, look at this, look at that. And then some patients, they just go on there like crazy, and they'll start printing the articles of things. It's great. The more knowledge, the better. If I can get them to do the research, I have to do less of it. That's even better.
This person said she's worried about heavy metals from the beauty products. How do they detox or lower the risk?
So the best way to understand what you have in your body is to do both the tests that we do, the blood and the urine. So the blood test tells us what recent exposure has come in, free floating, and the urine is a better representation of what you've been storing and looking at 21 metals. Then we do an IV that'll pull the metals out and check the urine after that IV for 12 to 24 hours to see what we took out. So observing what's free floating in your blood, looking at the urine to see what's coming out, then pulling it out and seeing what comes out. So those are the 3 steps of what we do to be super thorough with understanding what your exposure is. And that IV is both diagnostic and therapeutic, so it will show us what's coming out, but it's taking it out. So that's what you want to do.
Doc, it came quick, but someone wants to know how the other guy looks.
So yeah, I have a little bit of a
Other side.
little black and blue on my lip. So that's as a result of my karate class, getting my promotion. Here we are. And my friend Jeremiah on the left, he's a freight train. He's a big, strong guy. Our highest rank, our instructor, what we call our Hanshi, is next to me. Hanshi, Robert Cuccinella, has been teaching for over 50 years. Tom Sussman is our other highest ranking instructor. I think he's 8th degree, and Hanshi is 10th degree. And Jeremiah and I, in a perfect fashion, have come up side by side. We've always worked out together, trained together, and it's really a class of terrific guys. So the way our belts go is that each belt, different color from initial white, green, yellow, purple, blue, brown, black, all have different stripes, up to 3 stripes on them. When you get to 4th degree black belt, as I did in 2019, that's a white stripe over red. And then when you get to full 4th and you're going to work towards getting to 5th, they flip the belt so it's red over white. So it is not without a great deal of aches and pains and, fighting. And we have a full contact class, so it's not like we're doing just kata and basic stuff. It's a terrific class, and it's a great workout, and I'll never stop. But, I tore my shoulder in 2013, had surgery, tore my other shoulder at 16, had surgery. So it's not without, injuries and such, but it's amazing. It's invigorating, so I love it. New Generation Karate. It's over on New Hyde Park Road in New Hyde Park. Favorite place to go every Tuesday night. So, yeah.
I will...
So, in essence, what happens is when you do a test, and a test might vary, but, you do techniques for the instructor, right side, left side, punches, sweeps, hook kicks, and all sorts of different things. Then you would do, either self-defense techniques, You might do what we call EPONs, where someone stands in front of you and then they measure off and they come in with the fast punch. You have to block, stripe, sweep, take them down, etc. And then there's a combat circle that you would typically do where you have 5 guys around you and they all do the same thing and you keep going. On my first group black belt test, I think I went around 6 times, and Jeremiah did at the same time. I didn't think I was going to survive that. And then you fight. So when you're fighting, invariably you want to come in to hit and someone else wants to punch or kick. And a lot of times, you're going in when their idea is to kick, so you've got to block. So you get kicked in the hand, you might punch yourself in the face a little bit. Either way it happens, but
I saw
fun.
videos. It's intense.
Oh, yeah.
I won't lie.
It's crazy. It's crazy, but it's good. So thank you for your concern. I'm like, what's wrong with his lip?
Someone says that sounds a lot of fun. Is starting karate in your 60s or 70s safe for most people?
For people that start later in life, I started in college, but then I went to medical school, so I couldn't go past where I was because I had no time. Medical school is all consuming. Then when I came back, I started again in my 40s and have progressed and have gone every year since then. So I've been doing it about 18, 19 years, I think, at this point. But you keep going, you keep training and working out. So starting later, if you were to start in your 60s, that's hard. You just got to go very slow and stretch out a lot, You can't go too hardcore. So some of the lighter styles are probably easier, the ones that don't do the full contact fighting. But you should always do what you want to do and just keep your body moving and grooving.
I love it. There's our answer, guys.
Yes, a long-winded answer yet, but an answer, yeah.
There was no, shouldn't have been at the bar that night. None of that. Someone just wants to know, do cosmetics companies have to test for heavy metals like cadmium before selling their products?
I don't think so, because then you wouldn't find anything in those products. Just like the vineyards, they're not testing to look to see what's there, because then they'd be halted from making production, I believe. So I don't think there's anything that says in any food or drink, well, look at what we're going through now with RFK Jr. getting rid of the dyes and all the dangerous crap out of the food and the drink. The companies make stuff and throw it out there. And then in many cases, we suffer from exposure to that stuff. So I would hope that they'd create a board that would be able to look at all the different foods and what's in them and all the different drinks and say, you can't have these things in there. I think that's what's happening now, but, it's a long time coming.
Someone's saying we need an app to show all these things. And I think there's something out there. It might be more specifically for food products, not cosmetic products, but yeah.
It should be done for both.
Right. Yeah, it's Yucca. There's a Yucca one for your foods and, to make sure there's no oils and stuff like that.
That makes sense.
That's why.
See, smart people will always find a way to educate other people. So if you can get an app that says, okay, I want to eat this food or that food, and you can see what's in the food and you might not have it, that's smart. Even some of the fast food places are forced to put ingredients and, percentage of this and that into their food labeling. So it's pretty scary.
Crazy. We've got some questions about the Alzheimer link with the alcohol, if you want to get into that.
So, yeah, it's probably not a surprise for people to hear that excess alcohol can affect your brain. And everybody knows someone or a few people, and maybe a lot of people, that drink a lot and their brain function's just shot. They're just not sharp, focused. And then as your brain starts to go, the rest of your body follows suit. So you're killing brain cells with excess alcohol. I'm not saying you can't have a glass of wine or two with dinner or occasionally have a couple of drinks on the weekend here and there. And I've followed patients over my entire career that do very, very moderate amounts of alcohol, and occasionally they'll drink more now and then that are fine. But when they're my patients, their vitamin levels are great, their hormone levels are great, they're exercising. If you're going to go out and go to a wedding and have, a bunch of drinks before the wedding, the day or so before, and maybe the day after, do a lot of exercise. Some people come in for vitamin IVs to flush out the bad and to put more nutrients on board. Everyone's heard of these places in Vegas where they have these big vans or buses where after people go out and get smashed and totally drunk, they go on the bus and do a vitamin IV and they feel better. It's kind of a thing, but, you just got to balance it out.
Question, wondering if this is more of a genetic vulnerability.
So that's a very good question. So when I try to describe a topic, I try to look at a variety of things. As I mentioned before, people that drink a lot, if you're also getting heavy metal exposure from somewhere, could be from a variety of places, the alcohol in excess and then the heavy metals will create more damage. It's like a double whammy. Person doesn't take vitamins, even worse. Person's hormones are declining, even worse, because your brain needs your hormones. We've known that forever. And then looking at women that go into menopause, they have changes in their brain. If we start to fine-tune the DHEA and their nutrients and their hormones, et cetera, they'll do better. So you want to have great hormone levels, you want to have great vitamin levels, you want to look for metals, get rid of them, et cetera. So you want to look at the whole picture, not just say, this is the only culprit. Or this is the only insult. It can come from a variety of places. You have to look at multiple factors.
We got someone saying every week there's a different study. One that says red wine is good for you, one that's bad for you. I can't keep up.
Well, you have to think of who to listen to, because sometimes the studies are not well done and not founded. So I look at tons of studies all the time. I see what's happening within patients. I know what they're eating, what they're drinking. I know their vitamins, minerals, hormone levels. So I know how well people can do when they fine-tune the picture. And I can tell you overwhelmingly for the majority of people that red wine, out of all the types of alcohol, is probably because of the OPCs, proanthocyanidins, the good nutrients in there, are probably better and more protective than the other types of alcohol that people consume. That's why they said for many years a glass of wine with dinner is fine. And some people might have 2 glasses of wine. So I don't see a problem with that. It used to be that if a good study came out about vitamins, a bad study came out, a couple of months later, because the anti-vitamin people are always trying to put bad information out. It's kind of like propaganda.
It's unbelievable.
There was a study about the benefits of beta-carotene decreasing the risk of cancer. It's probably 10 or 15 years ago. And then a few months later, beta-carotene might cause lung cancer. I said, what? I said, that goes contrary to everything that I've ever seen. Let me just look into this study, because I knew there was some sort of BS about this. When they looked at the study with beta-carotene, they thought it might increase the risk of lung cancer, which it couldn't. The levels of beta-carotene they looked at were so low, it was almost as if you didn't take any beta-carotene at all. I said, okay, well, that doesn't make sense for them to say that that's possible when higher levels of beta-carotene and tons of other studies say that it's protective. Then I looked at the population cohort of the study, and in that population of people were smokers. So I said, are these researchers that stupid that they would include smokers, and smoking is obviously the highest cause of lung cancer, in their study and say that the beta-carotene was causing a problem and not 4,000 chemicals in cigarette production?
Tar, I don't know.
I said, yeah, tar, nicotine, cadmium, formaldehyde, it's 4,000 chemicals in the production of cigarettes. So they're trying to say, and maybe they just thought that people weren't going to look at the study, or doctors like myself who thought it was a ridiculous study weren't going to look and see every part of it. So they kept people in the study that were smokers. If you're doing a really good study, first of all, the number one cause of lung cancer, you have to take those people out of the study, because that's going to cause it, not insignificant amounts of beta-carotene. And then you'd have to look at different levels of beta-carotene and see, well, maybe it wasn't protective when it was 1/100th or 1,000th of the recommended levels. So those people were kind of laughed out of the medical community because they just did a horrible study. But I think that was on purpose to balance out what people were hearing from the research on beta-carotene. So
we got a good question here. Our Rumblers are out today.
Awesome.
Shout out. Hi, Doc. How common is it for research studies to be funded by the very companies that make the products being studied?
So you could look at a great deal of the pharmaceutical research. Who pays for those studies? Pharmaceutical company. It takes a lot to do a big study. And sometimes if you're doing 5 different sites, 5 different hospitals or facilities around the country, and lots of doctors and researchers within that realm, who's going to pay all that money for that? The people who tend to make the money when the study shows that their product is wonderful. And that may hold true for almost any product that's made. That's why when you look at studies, you want to make sure that the study says the researchers in this study have no conflict of interest. They don't work for the drug company. They don't do that. When I go to conferences and listen to doctors talking about things, they will always have on their first page, when they have that little slideshow, it'll say their history, their credentials, what they've done, all the research. Then one page will say, I do not have any conflict of interest. I don't work for the drug companies. I don't work for this, that, the other thing. And then you know that at least that person's research is going to be less biased or unbiased. But who pays for those things? There's some comment about the FDA, being paid by drug companies. And I saw this a while back, that the FDA can in and of itself have enough money to cover all the expenses for all the studies that are being done. And the drug companies put money into a pool or a big fund so that those people can get paid to do the studies by the drug companies. And I'm sure it's even worse than that.
Plenty of questions in the chat regarding COVID, and we're gonna skip through those questions for the sake of staying on YouTube.
You can pop a couple of them out. I mean,
They just want to know, or they're just kind of stating the idea that a lot of those studies were maybe falsified.
I think that's a correct assessment of the entire picture. You have to be very wary. You have to look at a great deal of information. A lot of information is coming out now. Even the CDC published the risks of all sorts of side effects that have come out. And I popped this up on my phone. And again, let's see. Where did I have this?
Live. This is live.
We are live.
And we're still on YouTube, so that's a good sign.
So I have it here somewhere because I thought it unbelievable that was what was being described, but it's true. Incidents of all sorts of different disorders are up by massive numbers.
It's amazing that, once you actually look into it, have an administration that is willing.
Here it is, Pfizer's own data. 279% spike in miscarriages, 487% spike in breast cancer, 1,048% spike in nervous system issues. But people can look this up. I think you can get this on Pfizer's website because this is where it's all coming from. But the list of all the autoimmune diseases, there's also a great video where Ron Johnson, the white-haired senator from wherever he is, Wisconsin, I think, had all the armed forces together, and all the doctors and researchers there were talking about how autoimmune and miscarriages, and a lovely doctor who is an oncologist was talking about how the P53 gene, which helps you fight cancer malignancy, was being inhibited, and that's why these turbo cancers are occurring. You can't deny these increases in numbers of all these things. It's being seen across the world, so that's why people are questioning everything, and they should.
Is that related to? Are they aiming that towards like the actual post-COVID, like after getting
injectable
or injectable?
They're correlating that with an injectable.
Wow.
And the more injectables, some of the studies show, like Australia, the higher the risk of other problems.
Wow.
And being sicker if the bug comes back. So whether or not people want to hear that, I just tell all my patients, go out, look, read, research, gather information, try to go on different search engines because some of them might be more controlled than others. People need the truth.
You got the chat a little somber right now with that one.
Well,
that's insane.
You got to look, you have to learn, you have to see what's happened and what's going forward.
Crazy.
Let's see, we've got some good comments on plant compounds found in nuts and veggies and fruit. Phytosterols are great. They may inhibit the absorption of cholesterol. They may also work as a great antioxidant. Individuals that have, and we've been talking about the Mediterranean diet and nuts and seeds and veggies and such, and some of the fruits decreasing the risk of diabetes and, blood vessel issues and plaque and organ dysfunction. The study here, published at Nutrition 2025, a large flagship meeting of the American Society for Nutrition, gigantic organization, they're reducing the risk of heart disease and diabetes by a lot, by consuming these things. So, people say, I ask them, well, what do you snack on? Oh, I snack on chips. I snack on blah, 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 candy. I'm like, no. I said, go out and get some nuts of different types, Brazil nuts, macadamia nuts. There are a lot of different nuts. Some people, we tell them to put them on a pan and under the oven, put a little bit of olive oil, maybe a pinch of salt, and you could roast them. And you could make your own. You can get organic nuts and then roast them. Sesame seeds, sunflower seeds, a lot of these things, it's really easy to do. Have more vegetables in your diet. Last week, and I'll go again today to Uncle Giuseppe's. I call Uncle Giuseppe's everybody's favorite uncle. Facts. And they've got this massive, 100-foot-long counter with all sorts of food that they just prepared, and they put it out there, which is like crack for an Italian. You're looking at all the eggplant of every different preparation, and they make zucchini like El Molino, the restaurant does, where it's cut thin, and there's a little bit of that flaky hot pepper with garlic and olive oil, and it's just amazing. And they have tons of fresh vegetables that are sautéed or that are grilled. There's just so much great stuff there that I'll go there. And you end up spending a couple $100, but you're getting, half a fridge full of great stuff to snack on. Why would you snack on, junk food if you have good stuff there? I'm not saying you can't have, chocolate now and then.
Well, I usually end up at the deli aisle with 2 pounds of prosciutto sliced up.
Well, prosciutto's good. There's no carb in that.
True.
Prosciutto, mortadella, there are so many things that are Italian staples. And it's interesting. You look at all the people, generations before us, that had prosciutto and meats, a lot of meat because that's what people would eat. Didn't have as much carb. Although the people that did come over and have a decent amount of carb were doing a lot of physical activity, they lived very healthy, long lives. And all the junk food is what's shortening the lives of the generations we see now. And there are more kids that are super overweight, more kids that are diabetic. It's just the American diet has been a disaster. Now, they were taking a lot of the junk out of those foods. That'll help, but you still have to get back to the Mediterranean diet. Why not?
See, the chat doesn't know, but the doctor, when we were getting ready to prep for the show today, he said, I was going to grab some sandwiches from this bakery, and I forgot. And I'm just like, Doc, don't tell me. Don't tell me.
The Italian sandwiches. I watch all of those things on Instagram where they're either in Italy or some big city here in New York and Brooklyn, and they're cutting open this wonderful bread and putting in all these wonderful ingredients. I was like, oh, my God. It reminds me when I was a kid, and my family used to do that. But there's a lot of good memories, and I could think back of my grandmother and, of course, my mom and her sisters just making all this amazing food over the years. Some of it was a little bit different, like cabozzelle. Only Italians would know what that means. I'm not going to really describe that too much on the air. But, the wonderful foods. Artichoke pie is still one of my favorite things with garlic and mozzarella. So there's a lot of good foods to have, and you don't need to rely on junk food over and over again because it'll just make you sick. But those foods will make you healthy.
Yeah. Got a stem cell related question over here.
Mm-hmm.
Find my cameras. My mother is in good health, but she's 83. I'm wondering if stem cell therapy is a good idea to keep her body rejuvenated. What are your thoughts?
Yeah, it's a great idea. I've been saying that for better part of 15 years because you're taking your cells from your body, which is the perfect idea, and spinning, separating those stem cells from red blood cells and plasma within, the extract from your bone marrow. It takes a minute and a half to extract once we sterilize and numb the area. And you're putting in these wonderful, brilliant cells that can become anything. And they can go to your heart, lungs, liver, kidney, pancreas, brain, gut. We can put them into your joint to create repair, and that's what they do. They'll go where the damage is, become brand new cells of that damaged tissue, and create repair. That's been known for forever. And if you just look at Google Scholar and plug in stem cells, there's 5 million studies, citations, and such. And all the time you look at your own stem cells from your body, the studies will say safe and effective, safe and effective. That may not be so with someone else's umbilical cord stem or amniotic fluid because it's foreign. You don't know anything about the donor. That's why we don't do that. But we've had people come in for all sorts of different problems and have seen terrific results. And we have people that come in to do stem once a year because they want to rejuvenate and make their body healthy and strong. One of the funnier things, we did stem on my mom a few months ago, and she called me a week or two after, and now, this is a few months out, her hair, which is all salt and pepper now, is black from her ears going around to the other side and is marching upward. So she's getting black hair at 95. So it's pretty amazing what your body can do once given the appropriate stimulus. But they're your cells, and those cells are meant to do that. This is not something that was made in a lab, forcing a chemical to do something and blah, blah, blah. It's a brilliant idea.
Follow up on that. They're asking, what are the how bad is the pain threshold? I don't want her to hate me for it.
Most people don't complain about it because we numb the area, and it only takes a minute and a half to do. So this is obviously your spine. We don't go near your spine. But if you can see, as the spine curves down towards the back, it ends in a little bump here on both sides. So that little bump, we sterilize and numb, and we extract from there. It takes a minute and a half to do that. So you'll feel a pinch when we numb the skin, and we lay the anesthetic on the bone. As we extract, some people feel like we're pulling on their leg. No one's really complained of it, and you may be sore for a day or so, but it's a pinhole, and then we extract the fluid, spin it, and we put it back in your body. So it doesn't take a long time to do it.
He said, we'll see you soon, Doc.
Awesome.
Here, I'm putting up that
We had a
phone
lovely,
number.
lovely lady, one of my oldest patients, and her great-grandfather was John Deere, and lovely lady. She would come in wearing Chanel outfits to the office. I'm not going to say her name, but it was different because she married into a different last name family, another big family, car company, I think. But she was charming and lovely. She wore Chanel outfits to the doctor's office. I mean, who gets dressed up like that to go to the doctor's office? She was like she just walked out of, Vogue. And she was lovely, always got a big hug and a kiss on the cheek from her. And she would come in once or twice a year to do it. I think she lived to 102. She was playing golf well into her 90s. She was just mentally focused and driven. And everyone in her family, and I see her niece, another young lady who was named after her, her namesake, comes in. But a great family, wonderful family, very strong, really intellectual family that, work. And they did a lot of fundraisers, a lot of charity work, but great, great family. But yeah, and she looked terrific, up until 102.
Someone said golf into her 90s?
Yep.
I need to figure it out.
Yeah.
That's insanity.
True story.
Trump will be golfing then, I think.
Yeah, why not? It's one of the only things you can play into your later years, And sometimes, and there's another funny story. Years ago, I played with a friend of mine. We get to a course, and it was two of us, and we wanted to get out and play. And, sometimes they pair you up with two other people. So they did. And there were two older guys. One guy was tall, about 6'4". The other guy was about 6 feet. And these guys just had perfect swing. They'd hit the ball straight, not terribly far, but they hit the ball straight every time. And they came out and they beat us. Their scores were great. You don't have to hit 300-yard drives. And so I had asked him, I said, so how long have you been playing golf? He says, my whole life. He said, I've been playing since I was like 9. And I said, wow, it's a lot of years. He goes, yeah, 80 years. I'm like, what? You're 89? He said, yeah, every bit of it. I'm like, you're 89 years old and you hit the ball like that? I said, he's hitting 200-yard drives, which 200 yards is still great. But he played a beautiful game of golf. I said, what's your secret? He goes, eat right, exercise, never stop playing golf. And have to admit the arthritis of my back has limited my swing a little bit, so I'm not all over the place. And now I can hit the ball dead straight. I said, okay, we'll take that.
That's great.
But really, and we had lunch with them afterwards. Really, really nice guys. I was like, wow, 89. Still playing golf.
Wow.
Of course, my friend was bewildered and depressed that these guys that were,
Beat you.
I think 87 and 89 beat us. But I said, forget about that. These guys are 89. God bless them.
Yeah, that's amazing. Oh, we got some videos.
Oh, yeah, let's pop up some videos. The lovely lady who I think had rheumatoid, she came in with all sorts of aches and pains and problems, and she had a wonderful outcome. I think her name was Donna. Let's pop her video up.
I've been a patient of Dr. Calapai's for several years. After looking at my last blood work, Dr. Calapai said, we recommend that you're a good candidate to receive the stem cell therapy. I was excited because for years I was looking forward to doing it, know the benefits of it. I've seen it. I've seen other patients, so I knew the outcome would be great. Did the stem cell therapy. Within about 3 days, I would say I felt great. I could tell you within that 2-week period, I've noticed that my body changed a lot. I am no longer going to bed tired and waking up exhausted. I found that I'm energetic in the morning. The restless leg syndrome that I suffered from for years, I noticed that also went away. My fatigue went away. Started to see a lot of improvements within myself. I suffered from asthma. I could not be around anyone who smokes. After being treated with a stem cell, I realized that the cigarette doesn't bother me anymore, which was great because I always was fearful that I would have an asthma attack, which has happened in the past. I'm grateful for not having any asthma attack after doing the stem cell treatment. Over the years, I've found that Dr. Calapai is very patient, and he explained everything to me, the entire process for the stem cell, the reasons we are doing it based on my blood work. Didn't expect my arthritis pain to go away, and it did. I didn't expect my back pain to go away, and it did. The asthma, I was very leery about, but I'm surprised. I knew it was going to work, so my expectations were high.
Yeah, she's lovely. Wow. Lovely woman. And, when a person comes back, usually we see them 3 weeks after the procedure. We make sure they write down week to week everything that they're feeling, then in the 3 weeks to 4 weeks after that. And to see that significant a result that quickly, is pretty dramatic. I mean, most people don't believe it until they see the person or the person tells them, hey, look, this is what happened, and now my problems, have changed or are gone. So it's pretty terrific to see people get that kind of result. But these are things that only happen when you're using your own cells to repair your body. It's just as simple a comment as that. You're using your own cells that know your body, that have the same language as all your other cells, to create repair. You're getting new cells in those organs. You're making those organs younger. You're getting more neurotransmitters made, more hormones made. It's common sense. But the powers that be don't like it.
Someone just asking exactly what is the system? Does it stop the immune system from attacking the joints?
Yeah, it decreases an abnormal inflammatory cascade. So, in a simple way of saying it, your body has its own regulation mechanism. If something goes off and it's not working right, that inflammatory cascade can be inhibited by stem cells and, for lack of a better term, shut down. So with lupus, rheumatoid, diabetes has autoimmune component, and many of these things do, MS. You're putting brand new cells where the damage is, because the signals sent by those damaged cells, just like you have an infected tooth or foot or gut, that infected area sends signals, so your antibodies and your immune cells go to kill things. The inflammatory cascade allows stem to attract to that, and the degenerative cascade allows stem to be attracted to create that repair. So it's the greatest idea in the history of medicine and science. Use your body to repair itself.
a lot of people just saying, wow, that's incredible. But one wants to know, does this treatment affect just the joints or the whole immune system?
Well, your whole body. So we inject it into the joints to repair damage because you don't have blood flow pumping stems into your joint like you would if you do an IV and your blood flow's pumping into your heart, lungs, liver, kidney, pancreas, gut. We do the nasal droplet with 2 syringes, one at a time, where we drip the stem cells into your nostril where you're laying on your back. That's state of the art. And that hits the back of your nasal cavity, gets into your blood vessels, into your brain, and creates repair. You could look at the videos on the website specific to stroke, MS, Parkinson's, Alzheimer's, macular degeneration. So we have evidence of it going to any part of your body. Again, that's the beauty of it.
And how many sessions are usually needed?
Typically 1 treatment. There are people that have, had a bad stroke or a bad MS or Parkinson's that 6 to 12 months later will do it again because they got great result. They wanted to do it again. And there's no reason why you couldn't. There's no risk. There's no downside, no side effect. They're your cells. So, the idea is ingenious. It's the best idea in trying to improve health conditions of all.
Is stem cell therapy for RA covered by insurance?
Insurance doesn't cover stem as yet. Although if you talk about a slightly different mechanism, there are people that have cancer, a bone marrow transplant is stem cell. So it's covered when they have that mechanism and that massive expense, and you're in the hospital for 3 weeks and you're doing radiation and chemo, et cetera. In that realm, it's different. But they don't cover it for, the other areas. I think that it should be, but because there are a lot of different outside forces that control what goes on, I'd be hard-pressed to say they're going to change the status quo with all of these procedures. So there are some orthos that'll put stem into the area when they do a surgical procedure, and I applaud them for that because they've been carrying along stem for joints for many years, but other ones would just rather do the surgery. Surgery is a big ticket. And not do the stem. And we've had patients that have done stem into their joint, their foot, their ankle, their knee, their hip, shoulder, their back, and have not gone for surgery. So I think that's wonderful. There are people that are diabetic that when we've done stem IV within 2 to 4 months, sometimes 5 or 6 months, they're non-diabetic. And you watch their sugar drop, you watch their C-peptide go up, that's the production of insulin, and you back down on their meds, and that happens. And there are videos on the website for the diabetes picture. So I think that's terrific. But endocrinologists may not like that.
Someone just said that, the person before mentioned restless leg syndrome. They want to know, what causes restless leg syndrome? I've been dealing with it since I was a kid. Very annoying.
Yeah, it's hard to say because you're ending up having this neurological mechanism where your nerves are firing and your brain is telling your nerves to fire, so your leg keeps shaking. So does it have some correlation with nerve inflammation or dysfunction? Probably. Does it have some heavy metal effect? Certainly could. So I don't think there's an absolute definition as to there's only one cause of restless leg. But the beauty of the picture is that doing a therapy with your own cells was able to stop it. So you're sort of recycling and maybe pushing a circuit breaker to restart dysfunction, stopping it by using your own cells to create repair. That's one way to think about it. Wow. Although traditional doctors, if they think there's nothing that can work, they just recommend meds and meds. The funny thing is that, my patients all have other doctors, and sometimes they'll tell their doctor, I want to go for stem cells. And a lot of times I hear, the doctor says, we're not there yet. I said, what does that mean? It's not as though you don't have 160 years of using the term stem cell all over the world, where Dr. Haeckel in Germany was the first one to call it a stem cell. It's not as though you don't have at least 5 million studies on even one search engine, Scholar Google. And if you looked up all the search engines and gathered every bit of research on stem cell therapy for all the different indications or areas, they would say, yeah, of course, stem cells is great. Use that. Why not? But they don't want to look at it. We're not there yet. But in the same breath, they'll give you a drug that's only been out for 6 months. And remember, a lot of drugs, once they're out, you start to see bad side effects and they pull them. But you're using the patients as a proving ground for those things. So it's sort of duplicitous to say, oh, here's the new drug. Let's see what happens. As opposed to, let's look at something that's been researched for every degenerative disease in history and it has been used on probably millions and millions of people worldwide over all these years, and throw that away and use something that's a guess. I just tell people, think about it for a minute. They're your cells. They can't hurt you in any way, shape, or form. They're creating repair. That's the only thing they do. So there'll always be a battle, and people understand why.
Yeah. As the chat's saying, the system is broken.
Yep, it's manipulated.
Horrible. People are commenting. They're just not asking questions. But guys,
That's right.
if you have any questions, this is your chance.
They have a good understanding. We're trying to make it as clear as possible. We've got a couple of emails, lots of emails from the website. Which diet is best for me? And people ask this all the time, and I say, there's no diet name that I can show you or get you to read a book. It's going to give you every bit of information. The best diet is whatever your name is. It's Joe's diet. It's Karen's diet. It's whoever. Once we see what your blood work shows, we want to make sure that you're taking foods out of your diet that you're allergic to, maybe even delayed reactions. We want to make sure your vitamins are perfect. We want you to have good protein sources, keep the carbs and sugars down, have lots of vegetables on board, put all the good things in. And this is easy to do at your second visit because I have all this information in front of me. And with that, you see your best outcome because it's specific to your body. With vitamin recommendations, specific to what your blood test shows you need or you're low in. And then to make a vitamin pack where I can check off on a pink sheet what I want in your morning pack and your evening pack allows us to make your vitamin levels perfect and suit your needs, suit your body. If you're an athlete, if you're not, if you're older, you're sedentary, doesn't matter. We'll suit the needs of your body based upon your blood test. And then once you're on the vitamin pack twice a day for a month, we'll recheck the abnormals on your low vitamins. If D was low, and now if it's perfect, great. Then people stay within that recommendation. So it's scientific. It's not just randomly winging it and hoping for something to happen. But that's all within the whole approach. Another quick comment just coming to mind, that everybody wants to do these GLP-1 injections, and I think it's good to burn down sugar, to decrease how sugar damages your blood vessels, your nerves, your organs inside your cells. But I tell people this is not a standalone treatment. If you want to burn down cholesterol, triglycerides, weight, sugar, it can be one of the things that you add on. It wouldn't be the first thing that I recommend. So with the initial visit, I tell people, start cutting your carbs. We give them a handout, 30 grams or below per day. Exercise every day, walk every day around the block, indoor, outdoor bike, Pilates, yoga, weights, whatever you want to do. Play sport, whatever you can do. And as you add all of these things, you'll start to see improvement. You'll feel better. If we need to correct your vitamins, minerals, and hormones based upon your blood tests, we do that. And if you're starting to see the numbers change and your weight's coming down, your sugars are coming down based on secondary blood tests, great. If a person has a lot of weight to lose, we might use the injectable, once a week for a few months to just help to decrease appetite and to add like a little bit of a octane into the fuel to make it work better. But that's the best way to do it because then when you're off the shots, you still have kept that weight down. You don't gain it back because you're doing all these other things that will create the best outcome.
Comment, I wish I lived in Long Island. You would be my doctor.
Awesome.
Hey, listen, when you do decide to move to Long Island, it's going to be on Long Island.
And remember, we
Things
do
are on Long
telehealth,
Island.
so we could do your visit over the phone and either send you a prescription or get a lab to get your blood done and do a second visit to go over your blood work and correct your vitamins and hormones. So we're doing a lot of that now, so much so that I've had to hire a nurse prac to help us do that because we have a lot of people that are calling for it.
Website below.
Yep. Give us an email at the website or call the office. We'd love to help you out. Another email. There's a lot of information out there. Who should I listen to? Well, this is a great question. But there's a very simple answer. You have to look at experience of the individual to know whether to listen to him or not. Now, there are researchers that never touch a human body, There are people that write articles that are not PhD researchers involved in a good study, or they're not doctors that never touch or examine the body, can't read an EKG. So the people who don't have that experience, I don't think, have enough for people to listen to. And not to toot my own horn, but in 39 years of being a physician, of examining, I don't know how many thousand patients, looking at this blood work on all of those patients, fine-tuning diet, recommending vitamins, minerals, correcting hormones, going back and forth, fixing, looking at research, and looking at what actually happens to your body when we make the recommendations for these things. There couldn't be someone with more hands-on, stethoscope on, blood on experience in doing this. It's just two different worlds. If someone makes a comment and they don't have all that experience, they're just throwing words in the air, and they don't know what they're talking about typically. I like people that are online that say, "Oh, use this and use that. It's going to do this or that." It may not. You don't know if your problem can be improved by taking the vitamin or the substance they're trying to sell. So forget all that stuff. Don't go to the internet for medical information. Learn about your body, and that's where you get your medical information. We take it from there. Do not go to the internet for advice.
Learned that one early.
Soon they're going to be AI doctors. Oh, Dr. AI, what should I do? That's a little scary. Another question on low back pain, which we see and hear all the time. So, and Anna has had 3 kids. God bless you for having 3 kids. Your poor body. So when you have kids, even with the first, you're stretching out your ligaments of your low back all across here, sacroiliac, even pelvic and pubic ligaments. And they don't go back to where they were, and they're not happy as they were before having the baby because they're worn and strained and damaged to some extent. So for a lot of that, we typically will get an MRI done, see the extent of the damage, and then we could do PRP, platelet-rich plasma, where we take your blood, spin it, and inject it right to the area of damaged ligament based on what the MRI says. There are tons of fibers, millions of ligament that crisscross in different layers of your low back, so peppering the PRP into those areas can create stimulus and try to create some repair and growth. If it's a mild problem, PRP is a great start. If it's more than mild, if it's chronic and it's really been there a long time and it's relatively severe, then we do stem. And you're putting those in, you're making new cells, you're weaving in like you're weaving the fibers in of a tear in your genes, and you're creating dramatic repair. Pretty cool.
Someone just said, "You're making a great case for stem cells," and now we realize why they don't want us to have it.
Yeah, so there's nobody who can argue with what I'm saying. They might try to, And there were a few patients who spoke to their doctor about it, and the doctor said, "I don't want you going for umbilical or amniotic because you don't know anything about the donor," which I agree with 100%. But does the doctor not know that we're taking your own stem cells from bone marrow? We used to do fat when that was in vogue, 15 or so years ago. But the number of stem you would get from the fat was less compared to what's coming from bone marrow. But doctors are in their lane, They don't necessarily want to step out of that lane to do other things.
That's for sure.
I think we have another cool video on a gentleman with COPD. Do we have that?
We do. Which one? Which gentleman? We have 2 gentlemen in the ranks. Hold on.
We have 2. Dennis was one of them. He's wearing a dark shirt, I think.
They're both wearing a dark shirt, but I'll flick them on real quick. This guy?
Yes.
Okay, we got him. Ready to rock.
Now, he was like the 12th person that came to me from a family where the first person that came, I think we had on video before, Janice, she was having strokes and all sorts of problems, kept falling down on her video, and she's a lovely lady. She, after a couple of months, her niece brought in pictures to me, said, "How's Janice doing?" She goes, "Oh, look." And I'm like, wow, it's a nice looking garage, and the side of the house looks good, and what a beautiful garden. She said, Janice did all that. She painted the garage. I said, what? She said, yeah, it was too expensive to have guys come and do it, so she did it herself. And she planted her garden. And, you know, she talks about how wonderful she's doing, and still is. So she came in first, then like 3, 4, 5, 6, 7 other members from the whole family, you know, kept coming in. So it was a big family affair. But he had terrific results. When we did the stem that day, when he went out into the parking lot, he said he could breathe better. I'm sure he says that on the video, but he hadn't used his inhaler since the day of the stem.
Hi, my name is Dennis, and I suffer from COPD. And it, it was bothering me, and my cousin came to see the doctor, and they had great results. I knew how sick they were. So I saved up, and I said, let me see what I can do. And I got in touch with him through my cousin, Kathleen, and I come in and had it done. They gave me an IV and an aspirator, or forget what you call it, the thing they put in your mouth. And I did that, and when it was time to leave, I couldn't believe it. I was telling my cousin, she was with me. She was in the room with me. She's a nurse. And I said, Kathleen, I can't believe it. I can breathe better. I can feel it now. So she was astonished, and it just kind of got better. And now I can take deep breaths. I told the doctor about my surgeries in my back, and I was having some problems. So he gave me a shot in the back, and my leg, I think this was from my back, just kept going out on me. I could be at a party or in a grocery store, and I'd be walking, and just boom, it'd go out, and I'd be on the floor. And God forbid if I was at a party and had a few drinks, everybody thought I was drunk. And I haven't had that in over 2 months now. Depression I suffer from, PTSD, and I find that I don't know what it did, but I feel much better now. I don't go into those slumps, and I'm doing more. My overall quality of life is much better. It just seems to be helping me everywhere. In fact, I'd like to get it again so I could, go back to being 21. But it's really, I've told everybody I could, all my close friends, guys on the police department that have Parkinson's or starting Parkinson's. I had neuropathy, or I have neuropathy, from all the surgery on my back, and I don't have it as bad. In fact, I had one incident that I had to take medicine for, and since I got the stem cells, but that was just one time, and I mean it's
it's pretty amazing.
Burning,
Unbelievable.
Yeah, it's pretty amazing. It's a thrill for me to see patients and see the results they're getting, because nothing else does it. That's another important part about STEM. Nothing else does what STEM does. It couldn't. Because you're sending these cells all over the place. They go to where they're needed. They find an issue, and they create repair. Wonderful, wonderful
That was
thing.
unbelievable. Real quick, just one question. From YouTube, finally, YouTube joined in the conversation. What's going on, YouTube? When you remove stem cells, do they grow back and replenish?
Yes, that's a great question. So research has documented that when you're removing about 60 cc's of that fluid, it's back to normal within a week, sometimes a week and a half to 2 weeks. So that's the zone of when you remove the cluster of stem cells, when you remove all of that fluid, that's back to normal within 1 to 2 weeks.
Oh, got it.
So occasionally there are people, like we had a patient who was really bad diabetic, and we did a double dose for him. So we took out of both sides and gave it to him, and his results were pretty dramatic as well. And his response was super fast. I mean, we gave him twice the dose of the IV and the nasal. So, yep, we just tell people to look at the website, drcalapai.com, Call the office, 516-794-0404. Email us, chat with us, anything you'd like. We'd love to help you out. We spoke about vitamin packs. We spoke about the remote patient monitoring mechanism. There are a lot of cool things happening with RPM, where now companies are making a pair of glasses with the side part of the glasses being able to do a little bit of a read of your brain speed. So you can put the glasses on every day, and over the course of a couple of months, if we can predict with AI whether or not a person is going to develop memory loss, dementia, or maybe even Alzheimer's. So there's so much happening within this community that all the big medical tech researchers are coming up with different devices, but we're on top of that. We're going to be speaking today, tomorrow with another big company. You have other doctors that want to join in under our umbrella. Some big facilities want to do this. There's also a way to evaluate people that have balance issues and that could fall, and then you're getting notified if that person starts to have balance issues, so you can get an alert, contact the person, contact the family, get them into some physical therapy or something to help. So this is going to be like having a little medical facility at home where we can track everything and it goes right to the doctor's computer, so we can really take better care, best care of you. So it's coming. We're already doing that. So for those people that want that are Medicare, we certainly can set you up with that. Thank you for listening to the program today. Have a wonderful day. God bless you all. Be well. And tomorrow we'll be on the Amazing Rumble, LFA, the LFA world. We're back. Okay, people, do well. Bye-bye.